Good day, dental professionals. Welcome to the Dental Flow podcast. We are dentistry's go-to resource for insights into the business side of dentistry. Your host, Benjamin Suggs, will be helping you navigate through the currents of the ever-changing dental waters. This podcast is packed with innovative practice growth strategies, actionable insights, and expert advice, all tailored to help you elevate your dental practice to the next level. If you're ready to dive in, so are we. Let's get into the flow.
Hey, dental superstars. Welcome back to the Dental Flow podcast. As always, I'm your host, Ben Suggs. I am the owner of Flow New Patient Marketing, a dental marketing agency that helps dentists all over the country grow their patient base with profitable new patients. Today's topic that we're going to cover is month-to-month versus long-term contract dental marketing agencies. Which is better for you, the dentist? So let me start just by explaining the difference between those two things. A long contract, annual contract dental marketing agency is one that requires you to enter a contract of at least a year. Sometimes it's 6 months, sometimes it's a year, sometimes it's 2 years. We've seen 3 years as an option as well, which is crazy. A month-to-month dental marketing agency is one that they do not have a contract. That the contract is literally month to month, meaning that you have 30 days, any point you can cancel, move on and work with somebody else if you choose to do so. So today I want to talk about the difference between those two. And it's a timely topic for us because right now we are actually dealing with a situation with a new dental client that we're bringing on to help her with her marketing. And to her surprise, she found out just the other week that she is actually in a long-term contract with her current marketing company that she was unaware of. Now, to be clear, it's not like she just started working with them this year and she's in a one-year contract. She started working with them like 4 years ago. 4 years ago, and somehow they roped her into another year renewal without her knowing. So she's upset. We're upset for her because she wants to move on. She wants to launch with us and start reaping the benefits of our new patient marketing. But this company's saying, sorry, you're in a contract with us for at least another, I think, 9 months at this point. So it's a timely discussion to have now because that is the frustration that we see all the time with dentists that we talk to. We get calls from dentists who say, yes, I just signed a contract with this company 3 months ago and it's not working. We're not getting phone calls, but I'm stuck. I can't do anything. Is there anything you can do to help us? Even though we're paying this other company on a monthly basis. And that makes it tough for us. There's not a whole lot we can do. We try to do what we can to help them out, to get the phones ringing, but it's tough if you need to work with two different agencies at the same time. So we have solutions for that, but it's never ideal. It's never ideal for a dentist to be being pulled two ways with two different companies when one's delivering and the other one's not. But let me just go through, to be fair, I want to talk about some advantages that there actually are with using a long annual contract dental marketing company. So one I would say is the reality is if you're going to do search engine optimization, or now these days also answer engine optimization, which is just basically SEO for AI LLM models like ChatGPT and Perplexity and those things, it takes time. SEO takes time. It takes 6 to 12 months every time to really start seeing tangible, measurable, good results. And that's the same for us. It's the same for any company. There's always outliers. There's always that client that you sign on and all of a sudden their SEO triples in 2 months. It could happen. It's very rare. SEO is a process of building and building and building, optimizing and optimizing and optimizing to get that growth that you want to see. But it does take time. So that I understand why some agencies demand that you at least sign a 1-year contract, because if it's purely SEO, they need the time to get the result. Another one is like onboarding costs for dental marketing agencies are real. They're not small. Every time we bring on a new client, we have an output of cost and an output of time that it takes to get that client onboarded, up and running and going. So I understand why some marketing agencies feel like, well, we need to have a 1-year contract because we don't want to do all the work up front and have that client walk away after a month or two. Another thing is sometimes clients do just bail a little too early. If they don't get an immediate result, They say, oh, this isn't working. I don't want to do this anymore. And as a marketing agency, you're put in a tough spot because you know that it's rare to get an immediate result on something. It takes time to build it, to optimize, to make sure you're reaching the right people. So an issue. Now, my counterpoint to this is as long as we're doing a good job of communication and transparency up front with a new client for them to understand these things, SEO takes time. Immediate results are not always going to be there. Then the need to legally bind them into a contract is not necessary. And that's where the issue happens, is where you're saying legally you cannot leave. You have to use my services for the next however many years. Now, let's look at the other model, the month to month. And this is what my agency does. Flow New Patient Marketing is a month to month agency. So we have an agreement. We don't even do a contract. We call it a statement of work. And our agreement in that statement of work is that either party, us or them, and we have done it too before, can walk away from the relationship. We have that in for us because we have had some very difficult clients that were tough to work with, where we decided it would be best for us to part ways. But we want our clients to have that certainty entering the relationship so that they don't feel like, well, if this doesn't work, I'm going to be locked in for a year or 2 or 3. They can think, well, if this doesn't work, I know I can just move on to the next option and try something else. So we are month-to-month agencies, and what that makes it harder for us versus an annual agency is that we have to work harder every month to prove our return on investment. Knowing that you could be fired any month means that we have to be much more hyper focused on our results each month and work harder for those results to make sure that doesn't happen. And it means that we do react when we see, oh, wow, numbers are low this month. We need to figure out what's going on, and we jump in there because we know that that can mean a quick termination if that doesn't happen. The next thing is, we work for faster results. And that doesn't mean we're doing cheap things to get faster results. It just means that we know we don't have 12 months to make an impression. We don't have 12 months to get results for a client. We need to get results in the first few months. They need to start seeing the phone ringing as soon as possible in order for us to maintain that relationship with that doctor over time. What that does is it puts us in a situation where we just have to push harder for that doctor's success. And I think any dentist would agree that's what you want from an agency, someone who's working hard for you to get results. Contracts, annual contracts, can tend to let agencies coast a little bit. They're like, well, we got them locked in for the year, so we can coast, we can take our time, we can do it at a slow pace. They may just show you vanity metrics that don't mean anything. The phone's not ringing, but hey, you're getting these clicks and you're getting this, you're getting rankings, you're getting all this great stuff. But if the phone's not ringing, it doesn't matter. At the end of the day, for us, that's all that we are judged on, is the phone ringing and people showing up in those chairs and doing dental appointments. That's all we're graded on. And one of the things I've never understood, and the reason that we did this shift probably 8 years ago, where we shifted to this model of month to month. And the reason is if I'm ever in a situation, a relationship between our agency and a client, where that relationship is soured and we're not doing it, or whatever reason it's soured, we're not getting it, why would I ever want to have that client still on our roster on a month-to-month basis if it's not working? That to me blows my mind why these other agencies who do annual contracts would want to keep a soured relationship on the books just for the sake of collecting those fees for the rest of that contract. So that's the way I look at it. We are month to month. That's how we do it. That's how we believe in doing it. And I think it's best for what our clients need. And I like the fact that if there is a case where we're not getting it done, that they have another option to move on. Now, we're very, very proud of the fact that even though we're month to month, year over year, we still have a 94% retention rate, meaning that 94% of our clients stick with us from one year to the next. That's been pretty consistent over the years for us. And the number one reason why our clients leave us is because they sell to a DSO. There's not much we can do about that. It's not that we're not getting results, we're not doing a good job. It just means they sell to a DSO. The DSO comes in and says, hey, we got our own marketing company. We don't need you guys. Thanks for your time. That happens quite a bit these days. It seems to be happening more and more as more doctors sell to DSOs. And we don't take that personally. I'm very, very happy for our doctors when they do sell. That was their goal, to have that exit. And I'm super, super proud of them for doing that. Another way to look at this is you as a dentist. Let's imagine that you changed your dental business model to when a new patient calls your practice, you tell them, yes, so to come in here, what we need you to do is to commit that for the next 12 months, you'll come in here at least twice. You need to commit to a 12-month relationship with our dental practice. Now, nobody would ever appoint with your practice if you did that. Nobody. Nobody's going to say, sure, why not? Let me just go ahead and, sign up for a full 12 months because they don't know. They haven't been there yet. They don't know if they come into your dental office and they don't like the place, or they don't like the service, they don't like the people. Who knows? Maybe it's too far of a commute. So you would never take that approach because your business would suffer from that. So that's why it seems odd to me too that dental marketing agencies take that approach when it's not necessary. If you're doing the work and you're getting results, you can maintain that client relationship for a long time. If you're setting expectations up front about the time it might take to get results, you can keep that client relationship for a long time. So that's just the way we believe in doing it. And that's why we've been doing it that way for a long time, is going month to month, no long-term contracts. And every time I talk to a dentist, like I just did with this client, and I hear their frustration and I hear them lamenting being stuck in the contract, and I hear how angry they are that they're stuck in this contract, especially if it auto-renews on them, it reminds me that I think we're doing it the right way. And I think after hearing this, you probably would agree as a dentist that we're doing it the right way. You should probably focus on working with agencies that go month to month and not ones that do force you into annual contracts in order to start the relationship. I hope this has been helpful for you. I hope that the point gets across because at the end of the day, you guys need to do what's best for you and your dental practice. I'll see you next time on the Dental Flow podcast. Thank you so much and have a great week.
Thank you for joining us for this Dental Flow podcast episode. If you enjoyed today's discussion and wish to stay updated on future episodes, please like, subscribe, and share the podcast with colleagues and friends. For more insights and discussions on dental marketing, we encourage you to continue riding the Dental Flow wave and tune into the next episode. Keep on smiling, learning, and flowing with the Dental Flow podcast.